Hi everyone, and welcome to HelpWithCovid's project showcase. Thank you everyone for coming today. Our goal at HelpWithCovid with these showcases is really just to highlight promising COVID-19 projects in front of an audience of people who might be able to help scale their solutions. So with scaling, that could mean connecting them with your contacts in your network, or providing advice or any mentorship, or even shifting some of your focus and capital towards the solutions addressing the pandemic. So if you would like to learn more about FundCovid, be sure to visit fundcovid.org, or you can find us on Twitter and on LinkedIn. Now with that, I'm really excited about the 4 projects presenting today. All of them come from the Help with COVID community, so they're going to be great. Now, for the first half of the event today, we will do the 4 projects and have them present their 2-minute pitches. And then for the second half, we will open it up for Q&A. So if you have any questions that you would like to ask the founders throughout the presentation, just make sure to submit them in the Q&A box at the bottom, and we'll make sure to cover them when all the pitches are done at the end. And just make sure that you specify who you're asking the question to when you post the question, so we know who to ask. In the event we do run out of time and don't get to all the questions, we will continue to answer the questions for a few minutes after the 30 minutes, and we'll send an email with the recording of the showcase and a transcript with all the answers to all the questions. So if you do have to leave at the 30-minute mark, just make sure you submit any questions you might have before you leave. Now with that, we'll start with our first presentation. So our first presenter will be Alex. Alex and his team are working on Contact Tracer. So Contact Tracer is the enterprise solution to save your business from shutdowns and losses due to a COVID-19 outbreak within your company. So when you're ready, Alex.
Yeah, I'm ready. Let's start. Okay, great. So hi everyone, my name is Alex, and I'm a co-founder of Software, and I present Contact Tracer for Business. So everyone knows that just one case of COVID-19 can stop the whole company for a certain period of time. And the main problem here that standard solutions do not work well. And the main reason that you can just find out with high accuracy who are the person who are already infected in your company. And the only solution here is to use contact tracing technologies that will allow you to stop the further spread of the disease inside of your company. And our solution, Contact Tracer for Business, is a system that can help your business to avoid downtime of your company. It will exactly tell you who your employees should be quarantined and who can continue working. It works in a very easy way from the first sight. Your employees just should get hardware attack or a mobile app on their phones, and our system started working. So the main things, when just one employee is detected as deceased, our first person will be noticed by a system report with a list of employees who should be isolated in order to stop the further spread of the disease. So the solution is designed to help companies with continuous production cycles and with a big amount of employees. So our main difference with different competitors that we can deploy our system in just one day. We have pandemic-specific analytics that based on our private algorithms. So that's all became possible according to our experience, because the previous 8 years we were working on different wireless and telecommunication solutions, and we already have a huge traction. So 3 months ago, we launched our application for individuals that right now have more than 70,000 of mobile app installs. And last 2 months, we were working on our enterprise editions, and we launched it just 1 week ago. And right now, we are looking for intros to system integrations in the industry, and I would be happy if you could provide them. Thank you.
Okay, great. Thank you very much, Alex. So up next, we have Brennan and COVIDX. COVIDX is a citizen science platform that's crowdsourcing wearable data and health surveys to help prevent the spread of COVID-19. So when you're ready, Brennan, go for it.
So thank you, James. I'm Brennan Hodge, and I'm the founder and CEO of Citizen Health, and we have a project called COVIDx, and we're helping people with underlying medical conditions reduce the risk of death from COVID-19, because most of the people that are hospitalized and or die from COVID-19 have one or more underlying medical conditions. And we're targeting people who have hypertension, obesity, and diabetes, with most of these comorbidities overlapping. Overlapping to form a group of about 100 million Americans. This is roughly 1 out of 3 people. COVIDx specifically is targeting the rural underserved populations, starting with Mississippi. We have already started establishing relationships with the network supporting these high-risk populations, and we'll work with them to distribute our app throughout their communication channels. It's pretty easy. It starts with the patient self-reporting current symptoms, underlying conditions, and general questions about living during the COVID-19 crisis. And each session over the subsequent days and weeks are a series of dynamic questions to help the patients better understand the determinants of their health. During this time, the patients also have an option to connect to wearable for more personalized data. And all this data together helps to quantify the determinants of health, which are essentially factors that determine our health outcomes. Each patient is giving a score and is guided along a journey to improve various health metrics through some nudges and gamification. On the provider side, the goal is to gain a clinical signal for COVID-19 to help physicians and providers provide the right treatment at the right time. So benefits overall, these underserved populations and at-risk populations are struggling right now to actually learn about COVID-19 with all the conflicting news out there. So we're trying to help present the actual truth regarding COVID-19. We give them options to track and improve their health, just related to anything, prevent the spread of this, and if they do need help, to request it, and also help the public health department source data. So we have a solid team behind this, established team for the past couple of years with Citizen Health, working on a few projects, and we have a pretty solid base of advisors. Our ask is connections with any public health agencies and or diabetes, hypertension, obesity programs to help distribute COVIDx through the underserved populations. Thank you.
Okay, perfect. Thank you, Brennan. Okay, so up next we have Careers Crossroad. Careers Crossroad is a job marketplace with a mission to help bootcamp graduates get the visibility they need to get placed in jobs, especially during this pandemic. The team has decades of experience in the recruitment space and even some exits. The founder, Ed Tan, is an ex-rocket scientist turned social impact entrepreneur and has been in the recruitment space for several years, where he discovered this gap in the system. So thank you, Ed, when you're ready.
Right. Hello, everyone. I'm Ed. We are Careers Crossroad, a job marketplace focused on bootcamp graduates. Our vision is we want to be the go-to marketplace for all bootcamp graduates. And our mission is we want to help these people of non-traditional background and underrepresented communities get jobs in tech, while helping companies achieve their diversity and inclusivity initiative with more diverse talent to their talent pool. Our team is made up of passionate founders and advisors who are serial entrepreneurs themselves, who are expert in the recruitment field for many years, running their own recruitment startup, and even have exits like Good.co. So companies today are having a very hard time getting diversity in their team, as we can see from the low representation from non-traditional candidates in companies. And bootcamp graduates are actually having a hard time getting noticed by these employers, as they are being filtered out by traditional ATS system out there. Pre-COVID, in-person networking events and career fairs were their only secret weapon to get noticed. However, now with COVID, all in-person events are gone, and now it's actually nearly impossible for them to get noticed. And there's currently no dedicated platform for them to help solve this very problem. So our solution is a specialized marketplace to help showcase these underrepresented non-traditional talents. We use AI to help match graduates to jobs that could be a great fit for the company. We look at their non-traditional hybrid background as an asset, and in addition to the skills that they learn from their bootcamp. So recruitment industry is a huge industry, as you could see. And the bootcamp niche is already at over 300 million. Bootcamps are actually churning out over 20K graduates a year. And this is increasing at a 50% growth rate a year, as research has shown. These are some of the milestones we achieved. We already have over 1,000 candidates signing up just from our initial launch. We have several institutions that also reach out to us organically to partner due to the very pain that they are experiencing. We also gain interest from a $2 billion recruitment firm just to pilot. We are looking to raise $400K for an 18-month runway. And we are looking for warm connections and to hiring companies to hire these bootcamp graduates, and also mentors, advisors, and access to a network that would love to be part of this mission. Thank you.
Okay, great. Perfect. Thanks, Ed. Okay, so we have one more project. The last one presenting will be Gift Card Bank. Gift Card Bank is a non-profit platform that aggregates donations of gift cards and distributes them to people in need. Gift Card Bank was started by Khalil Fuller, an award-winning social entrepreneur and graduate student at Stanford. So when you're ready, Khalil, you go for it.
Hi, I'm Khalil Fuller, and I'm the founder of Gift Card Bank. And our mission is to improve well-being and financial security by supporting people through their time of greatest need. And for many Americans, we know that time of greatest need is now. What do? We raise donations of gift cards for essentials, and we match them to the Americans who are on the brink. We prevent real financial shocks from causing devastating long-term negative spirals such as homelessness and a continued drain on the social safety net. Why now? Food banks are overwhelmed. As we know, 45 million plus Americans are facing unemployment, and food banks and food pantries are hit with this double-edged sword of rapidly increased demand, while at the same time, their volunteer bases are decimated due to social distancing. And so I was volunteering with a number of local food banks and realized how ridiculous it was that in the age of Instacart and DoorDash and digital everything, a single mother with 3 kids has to go and wait in line for multiple hours to wait to pick up a box of food. And so we're doing something about it. What we're doing is we're aggregating gift cards, both from donations from individuals of fractional gift cards, donations of cash that we turn into gift cards at a significant discount, as well as donations of gift cards from grocers and retailers themselves. And then we're figuring out who's in the most need through partnerships with food banks and other mission-aligned nonprofits. And we distribute those gift cards to people in need through the first ever kind of fully IRS-compliant digital gift card distribution system. In the last couple of months, we've raised over $100,000 in gift cards and formed a partnership with Kroger, the largest pure play grocer in the country. And we're going to be doing 2 buckets of pilots this summer. The first with local community-based organizations such as food banks, and the second with mission-aligned fintech companies. And we would love connections to philanthropists as well as grocers and merchants. So again, I'm Khalil with Gift Card Bank. Thank you so much.
Okay, perfect. Thank you, Khalil. All right, so thank you to all 4 of our presenters. We will now kick off Q&A. So if you have any questions that you'd want to ask any of them, make sure you drop them in the Q&A box. And make sure when you do ask the question to include the name of the person you're asking the question to, just so we know who to ask it to. Yeah.
So does the contact tracing app connect to other wellness corporate applications? Well, we've developed this solution to use it and with or without any other solution to big companies. It could work in without any extra information, without any COVID-19 information from external sources. You can just use it inside of your corporation or company without any extra specific information or accounts or any about health states. So you could just import the list of your employees inside of the program. If you would be interested after the session, I could also send you some demo information. You just can import a list of your contacts, of your employees, and just set their states of their health. So I think answered the question.
Okay, so I got one question to ask all 4 of you from Tanae. She would like to hear your plan for all 4 of your projects, your plan on localizations. Are you local or global? And are you planning to expand services anytime soon? Khalil, why don't you go first?
Sure. Yeah. For Gift Card Bank, we are focusing a bit locally to start with. So with one bucket of pilots, we're working with local food banks here in the Bay Area. And then for the FinTech app, we're having kind of targeted geographic reach in a handful of cities across the US. But the nature of our digital first platform is that it could scale nationally very quickly. And so we plan to be, have impact nationally before the end of the year. Global is another question. The gift card market is a global one, but we're focusing on the US because of the kind of philanthropy implications for the time being.
Okay, good. Ed, do you have an answer for that one?
Yeah, so right now we are national in US, and eventually we'll plan to expand internationally once we have US come.
So I think it's my turn to answer the same question. So yeah, on the first stage, we are focusing on the US market. So, but there are no borders for the application, for the solution to use it in any other company in any point of the world.
Because I'll chime in with my answer. And Alex, I just want to follow up with that. Today, I just got off the phone with our State Department of Health about what we're working on. And they said they are only interested in contact tracing solutions. So it might be beneficial to look at state public health departments, since they're all out there. They just got off a conference call with the CDC yesterday. Yesterday. And they're about in the middle of the pack in 50 states in the United States of being ready for contact tracing. So there's really a good opportunity to throw your hat in the ring there. Just throwing that out there. But for COVID X, with what we're doing, it's starting local, regional. We have some contacts with Mississippi, and that's where I'm at. And Mississippi is one of the most unhealthiest states in the country. And so we have a good target base, starting with rural areas, really the poor, uneducated, underserved populations in Mississippi. And then move out to the same types of areas in other states, really working through existing channels such as like diabetes prevention networks, obesity networks, hypertension networks. They're all scattered about through the state, but it's going to be scattered. It's going to be a local drive mostly.
Yeah, I also wanted to add what I mentioned just now. So originally, actually, were not national. We are actually localized, based in the Bay Area. That was pre-COVID. So actually, we even organized career fair and everything, and there was a lot of interest. And with COVID, actually, a lot of other institutions that was actually nationally in the US reached out to us because of the pinpoint they were actually experiencing. Some of them even asked us, could they fly all the way from New York, to be at the career fair and all this thing. That shows how much of a pain they are experiencing. And hence the reason why we actually opened up national after that. So right now it's expanding at a quite fast speed actually.
Okay, Alex, you got a couple of questions. Do you want to start with the one on the top?
Mm-hmm. Yeah, okay. So what is the encryption technique being used to protect user privacy for contact tracing? Yeah, a good question. So there are a few standards for contact tracing security technologies. So like probably you know about exposure notifications that were provided by Google and Apple, and we use this protocol as the base, but also we did several changes because this protocol, in case of encryption and privacy and confidentiality, is a good one, but it is also decentralized. In case if you want to use it inside of any company, so you should do it in a centralized way. So, and we did this thing.
Okay. Yeah. The market size for in general, there's about 280 million smartphones in America, and about 70 to 80 million wearable devices that can meet the needs of what we're looking for, and that is continuous heart rate monitoring, sleep quality tracking, and activity. Basically, your Apple Watch and Fitbit. It's the latest Fitbits over the past 3 years. For the most part, it doesn't necessarily matter if it's a poor community. A lot still have wearables, still have smartphones, so that's there. But as far as in Mississippi specifically, wearables, I can't really get a good number for that, but just 70 million across the country.
Okay, Khalil, do you want to do the question there at the bottom? Any plans to increase the gift cards from small businesses, perhaps working with Shopify or Facebook?
Yeah, that's so. When the initial idea was actually, so there were a lot of these initiatives to buy gift cards from local small businesses, and the thought process was, well, people are buying those gift cards to support the local small businesses, but they don't really need them. They're just doing it almost as a charitable thing. So what if we could get those gift cards and give them to people? What we found is that it creates, like, at a steady state, like, scaled environment that works, but it's tough when you have those small businesses that are actually shut down right now for a lot of them, and the matching becomes more difficult. So if we're trying to be a broad platform for, everyone in need, that they can go on and get access to a gift card, a Walmart, Target, kind of Kroger gift card is more broadly applicable than like the corner store down the street. And so there's some, the short answer is that at scale we hope to do that, but in the short term we're focusing more on the retailers that have a broader kind of footprint.
Okay, I see several questions. Also, are you tracking family members as well? Yeah, it's also a good question, because it's possibly it's the first question that people are asking us about how we are tracking contacts of people outside of the company. And I can say that no, we don't track it, because in this case, our solution is focused on just stop the spread of the disease inside of the company. In the case, if you just if you think that it's better to track it also, for example, for family members and other things, it's similar to the case that you that all of the citizens should use the same application, and only in this case you can see the whole situation. So I think you got that this is impossible that way, but you can stop the spread just inside of some little social group. For example, any company is just an example of such social group. And we see that this solution, according to our experience, when we have launched our application for contact tracing for individuals, so the latest feature that was, it's to use it with family members, when you can see their traces. And probably it's a better solution to use it inside of some small social group. And I think that we reached it.
For you remaining three, so one question came in was about what are your first milestones you have planned for the next 90 days?
Well, we actually really were set on working with our state of Mississippi, actually, from the public health department. But today it was kind of a upset, I guess, because I talked to them and they strictly said they were entirely focused on contact tracing, nothing else. But I did ask, what are you looking at in the future? What's going to be next? They said they have no clue how to get ready to vaccinate a mass amount of people. Like, they have no idea. That's something that they haven't even come across. So how to go about doing that, they said that's something that they haven't even discussed yet. I just want to throw that out there. So that was our plan, was to work with the public health departments, and it still is. But from those conversations, not too many states are focused on stuff that's going to happen 6 months to a year from now, which is really kind of what we're happening with. Implement contact tracing within COVIDx. Yeah, we actually started working with that. We forked the MIT repository and started working with that a little bit. They're a contact tracing solution. But I just realized that here in Mississippi, if we were going to start, it really wasn't going to work. We're in a conservative state, and people just don't trust any government or any invasion of privacy. And I'm just being honest, I don't think it's going to work as intended in the United States, period. That's just my opinion. It might. But from all the polls I've seen, people aren't going to let that level of intrusion happen. but I might be wrong. But if it's coming from Apple and Facebook or Apple and Google, I'm not going to do it. That's just me. Now from an individual company, a private company, possibly, but not those big behemoths. So the next 90 days, we have already discussed or had a couple conversations with Diabetes Prevention Network in Mississippi. And that's essentially, I think, about 20 locations throughout the state that have diabetes prevention programs. So they have monthly conferences or seminars where they go there, they check blood pressure, they talk about certain things. So it's really an avenue for distribution. So they can go ahead and send out our link, our URL to all their particular members, I guess you'd call it members, to help further the cause, because they're right in the same boat. They're sitting there trying to figure out how can we help these populations that aren't being served right now. They're the most at-risk population. So looking at those, I think would be a solid 90-day goal. So that's the next 3 months. I would say within the next 60 days, we should have something in place with I know the diabetes network and obesity. Hypertension is a little more, it's not as concrete as the others, but diabetes and obesity is pretty solid. So that's where we'll be hopefully in 90 days.
Okay, my turn about the first milestone. So as we've released the first version of our enterprise solution 1 week ago, so also the same as Verena, probably we have plans for the next 60 days until 1st September. So in the plan, it's just to make sales and to make distribution of the solution. Right now we already have several potential clients, some of them from Michigan, from automotive industry, and also we will have several conversations with system integrators, one from California and one probably from Texas. So right now we just focused on the sales process. Right now it's the first things first.
All right. As for us, our 90 days, so we already have a lot of interest from boot camps and companies. So we want to expand that, and also we are re-apping our site right now to support the boot camps. So development is going on and also since right now we have a bigger team, we have actually almost 20 members in our team. So hopefully by then we can relaunch the platform with the support for the boot camps, get more companies, and also get a lot more of the candidates to jobs. And hopefully by then we will also be sustainable, because to sustain 20 people is not easy. So we're going, and I think that just now also there's a question about non-profit and for-profit. I remember Peter Diamandis mentioned about for-profit, non-profit is a lot harder to sustain. And since the recruitment industry is actually quite lucrative and easier to get funding from the company. So that's one direction we are looking to be more sustainable. Yeah.
Okay, Alex, there was one here. I'm not sure if you answered already, but it is, what is the fraud prevention mechanism? Oh, no, wait, that was for gift cards. Never mind. So we have a question for all three again. Given COVID might be here for a while, how do you plan to stay afloat? What kind of operational costs do you all have? That might be private information, but if anyone feels free to answer that, they can.
Yeah,
Okay.
You go ahead.
Okay,
Alex.
go ahead.
You go ahead.
Okay. So I think the answer is bootstrapping. We have enough of resources because it's just one of our products inside of our company, DOS Software, because we also we're doing outsourcing software development, and we just plan the budget for next 3 months, and we have enough of resources for that period of time. Yeah. Okay, your turn.
Oh, okay. Yeah, for us, we're actually looking at grant funding, since we are a we're a for-profit public benefit cooperative. So that's unique. Can't necessarily look after VC funding. I mean, we can, but it's not in their wheelhouse. It's a relatively new type of entity. So we've rebranded and we're relaunching as that particular entity here in a few days. So you'll probably be hearing a lot about that. But the idea is we're going to crowdsource. We've had a previous regulation CF crowdfunding opportunity, and we're going to do something similar for this. But grant projects, we're looking at some grants right now. And once again, going back to that conversation I had with public health department, they said, look at grants right now because they're wanting to fund solutions to this. And there's a lot of money available. So we're looking at grants. There's a lot of them pertaining to what we're all doing right now. So that, and we have a solid volunteer network, and hopefully just keep it going with enthusiasm. That's for the most part. All of us have been volunteers up until this point. So we'll continue to keep it going and see how it plays out.
Yeah, and for us, we are actually pretty lean at the moment, bootstrap and everything, and also with a volunteer network and stuff. We have about maybe about 6 months of runway because of that, and also as mentioned previously, so once we switch on our revenue stream, we pretty much will be cash flow positive soon after that. So it's just when we are switching on the revenue stream, we want to get more traffic and everywhere in first. And also there's another reason why we are also raising some funds to sort of give us a bit more of the buffer for 18-month runway, so that there's more stuff that we can do and also sustain it.
Okay, so we've got another question for all of you again. I know that it was in your presentations as well, but if you want to answer it again, is Alex, we'll start with you. Is how much traffic do you have?
I don't think that in case of any enterprise solutions, that question is for me, but probably because we are working with different affiliates, with partners. Usually we just are connecting with them via LinkedIn, via emails, via our network. So I don't know how to measure my network. So I just have some contacts and I use them. I think that's more the question more about any B2C projects here.
Yeah, I'm kind of in the same boat as far as traffic. We got a lot of traffic, but what does traffic mean? We have an online community. We have over 400 and something members, and they're scientists, engineers, physicians, all communicating around fixing healthcare. And right now, COVID-19 is a big conversation because you're starting to see a lot of fractures in the system regarding just hospital systems, insurance, the CDC, public health agencies. So there's a lot of conversation going on with that. So that's a network we've been cultivating for a while. And, that it's pretty busy. But as far as specifically what we're pitching today, we had a previous project that actually did this. So connect a wearable to it. You can see all your health metrics, and we're nudging people in the right direction, trying to improve their health through actually a cryptocurrency. So we've been experimenting with this for a while. I think we had, last I checked, it wasn't much, about 700 members, users on that. And that's something I'd still call it a beta app that we rolled out. So we're rolling all that into what we're doing now. But for the most part, it's just been conversations trying to figure out what the right market is. And I definitely think we're narrowing it down, especially after that conversation I had today. But for the most part, that's it. No paying customers yet.
And as for me, as they mentioned, traffic. So we are sort of also a B2B2C marketplace. We haven't really done any marketing. And what we did was the initial launch that we tested on Eventbrite. So if you want to talk about traffic, that one has almost 10,000 people visited, and then in the end we have over who come to our platform and actually end up signing up on our platform is over 1,000 candidates, and that one was targeted more for the job seekers. So there's also companies. So as I mentioned previously, there's a list of companies and also boot camps to actually reach out to us organically, even though we never targeted to them and we never market to them, that desperately wants the service and solution, that they've even found other ways to reach out to us. So that's one of the things that we are trying to help support them eventually. Yeah. And also there's let's see, boot camps, and yeah, and there's also a firm, a $2 billion firm that actually reached out to us that they want to partner for a solution like that. Because right now there's actually no platform outside that's helping these bootcamp candidates. And it's not that they don't qualify. I've done a lot of research, talked to a lot of people. Eventually they do get a job, but it's through networking event and not applying online, to those websites, because it takes like a long time. Some of them will apply to 300 jobs a week and never even hear back from a single one. It's very demoralizing if you think about it. And it's not that they don't qualify for it. It's just that the system out there, the ATS, they're looking for those keywords, Stanford, MIT grad or something. Then if you're not, you went to a bootcamp, you get filtered out automatically. You don't even get a chance, for an interview. And how they get a chance for an interview is a lot of networking events, a lot of career fairs. In fact, this is one of the requirements for boot camps to their graduates. If they pressure them, and ask them to track how many events have they been going, and eventually they do get a job. But however, now with COVID, it's almost impossible. Now there's no more networking event, no more career fairs. So there's literally no way for them to get noticed anymore for those jobs. So this is a very big pain point for the boot camps. So we actually help solve that.
Thank you all for attending. And remember, if you would like to get in contact with any of the projects or, find out some more information, you can find that information at fundcovid.org, as well as any other future showcases we'll be hosting or other events. And also keep a lookout for an email from FundCovid with the recording of today's showcase and the transcript, so you can check out any questions and answers that came out of it. So thanks again, everyone, for coming today. We hope you enjoyed the showcase.